Hello everyone. Today we are going to discuss about macrolides. So today's lecture we'll learn about following competencies. So in this lecture we'll discuss about the introduction, mechanism of actions, antimicrobial spectrum of macrolide, pharmacokinetics, therapeutic uses, adverse effect and drug interactions of macrolides. Introduction. So macrolide are the antibiotic containing macrocyclic lactone ring in their structures. So from this picture we can appreciate the high macrocyclic structures. So all macrolide they process 40 member lactone ring in their structure except in azithromycin which is consists of 15 member lactone ring. So prototype macrolide include erythromycin. So total 4 macrolides include erythromycin, azithromycin, roxithromycin, and clarithromycin. So among these 4 macrolides, the erythromycins they are the natural macrolide which is obtained from the Streptomyces erythritans, whereas remaining 3 macrolide that is roxithromycin, clarithromycin, and azithromycins are the semi-synthetic derivatives of macrolides. Coming to the mechanism of actions, so macrolide they bind to P site of bacterial 50S ribosomal subunit, which in turn inhibit the translocation process of peptide chain. That is a movement of tRNA from A site to P site, which in turn inactivate or inhibit the protein synthesis and resulted in bacteriostatic effect. But at high concentration, they also produce the bactericidal effect. Coming to the development of the resistance. So resistance developed due to any one of these two mechanism. So first one is alteration since 50 years ribosomal subunit, that is mutations, and mutations is nothing but a certain heritable change in gene. So that resulted in alterations of 50 years ribosomal subunit due to the chromosomal mutations. Example, gram-positive cocci. The second one is the efflux of drugs by active pump, that is in MRSA. Now coming to the antimicrobial spectrum, so erythromycin, doxythromycin, clarithromycin, and azithromycin. So first we'll discuss about the erythromycin, which is sensitive to the atypical pneumonia, gram-positive cocci. This is Streptococcus cephalococcus, gram-negative cocci, gram-positive bacilli, and gram-negative bacilli. Whereas roxithromycin is sensitive for more potent than the erythromycin, which is sensitive to the moxilla and Legionella species. Whereas clarithromycin, which is sensitive to the chlamydia species, H. influenza, MAC, Mycobacterium leprae, H. pylori, and Toxoplasma gondii. Whereas azithromycin is same as clarithromycin, but having the more sensitivity against the Salmonella, Plasmodium species, H. influenza, Campylobacter jejuni, and MAC. Coming to pharmacokinetic profile of individual macrolide. So erythromycin they are naturally synthesized, whereas doxythromycin is semi-synthetic, and other clarithromycin, azithromycin also is coming to belongs to same class, that is semi-synthetic macrolide. Whereas durations of actions, if we're talking about erythromycin is a shorter acting drug, T half is vary from 2 to 6 hours, whereas roxanthomycin and other drugs they're the longest acting drugs, longer acting drug than the erythromycins. But about the absorptions, we're talking about the pharmacokinetic profile, fast profile, that is the absorptions. So erythromycins are incompletely absorbed from the GI tract, and they have high plasmapherin binding. So 80% that count contribute for plasmapheresis binding, whereas roxithromycin also having the good GI absorptions, but 95% is plasmapheresis binding. But whereas clarithromycins, they are undergoing a high fast metabolism, and azithromycins having the good GI absorptions. Coming to interactions with the food. So erythromycin does not interfere with the food intake, but roxithromycin, they decrease, if you're consuming the roxithromycin along with the food, that decrease the absorptions of the roxithromycins. Whereas clarithromycins have no interactions with the food, and azithromycin is also having the similar actions. Whereas acid labile, so gastric acid labile is erythromycin, doxythromycin is resistant to the gastric acid, so they prevent the gastric digestions. Whereas clarithromycins and azithromycin both are gastric acid resistance. Whereas when you're talking about the CYP3A4 interactions, so erythromycin they inhibit the CYP3A4 enzyme which cause the drug interactions. Whereas doxythromycin, they also inhibit the CYP3A4, can cause drug interactions. Similarly, uh, clarithromycin is also having the, they inhibit the CYP3A4 enzyme, microsomal enzyme, leading to the less drug interactions. But azithromycin, compared to other three macrolide, azithromycin having the less interactions with the other drugs, that is metabolized by the CYP3A4. Now coming to therapeutic uses of macrolide. So erythromycin and azithromycin are effective against the atypical pneumonia, whereas uh, clinda chlamydial infections like conjunctivitis, cervicitis in the children and pregnant women, azithromycin 1 milligram, 1 gram orally can be effective. Diphtheria, erythromycin can be given. Whooping cough, which is mainly caused by the pertussis, so that also can be treated by the erythromycin as a prophylaxis. Tetanus, as an alternate to penicillin therapy. Synchroid, which is mainly caused by the H2K, the drug of choice is erythromycin. Mycobacterium avium complex, we also can be treated by the clarithromycin and erythromycin. As an alternate to the penicillin, streptococcal infections like tonsillitis, pharyngitis, otitis media, so they respond to the azithromycin and erythromycin. Bacterial conjunctivitis, erythromycin can be, ointment can be given. Leptospirosis caused by Leptospira venerum is mainly treated by the erythromycin. Gonorrhea, syphilis, which is a STD, sexually transmitted disease, also can be treated by the erythromycins. Other use like mycobacterial pneumonia infections can be treated by erythromycin, clarithromycins. H. pylori, which is mainly caused the peptic ulcers by H. pylori infections, that also can be treated by the clarithromycin 500 milligram twice a day as a triple therapy along with the other regimens. Leptometres leprosy, so that also can be treated by the clarithromycin. Toxoplasmosis can be treated by the azithromycin and clarithromycin. To adverse effect, common adverse effect include nausea, vomiting, epigastric pain, and diarrhea. Erythromycin increases the GI motility by stimulating the motilin receptor in the gut. Hypersensitivity reactions is the most common adverse effect for macrolide: skin rashes, drug fever, eosinophilia, and hepatitis. Hepatotoxicity in the pregnant women is an adverse effect of macrolide. Now coming to the drug interactions. So erythromycin and clarithromycin should not be combined with theophylline, carbamazepine, sodium valproate, warfarin, digoxin, and cyclosporine because they potentiate their effect. Erythromycin should not be combined with a cisapride, which cause the QT prolongations. So among these macrolides, azithromycins are having the less side effect or adverse effect with a less interaction profile. Coming to the newer macrolide, that is erythromycin, they are also called as a ketorolide. Why they call as a ketolides? Because the presence of three keto group in their macrocyclic structures, and they are less susceptible to the methylations. They are semi-synthetic derivatives. It is mainly active against the microorganism which is resistant to the erythromycin and azithromycins. Mechanism of actions having the similar mechanism of actions like azithromycins. Pharmacokinetic profile, their absorptions well absorbed orally, bioavailability considered 60%. Resistance to the gastric acid digestions. T half is 10 hours, which is a longer acting drug. Coming to the therapeutic uses, community acquired pneumonia by Streptococcus pneumonia, it is sensitive to this, so that can be effective for treating this. Other respiratory tract infections, acute bacterial sinusitis, is resistance to the other macrolide. In that situation, this drug can be applicable. So talking about the adverse effect of the drug, it's common adverse effect that is nausea, vomiting, diarrhea, blooding vessels, and hepatic dysfunction are the adverse effect of this macrolide.